Okay, hello everyone. Thank you for joining us today for this educational webinar about treatment options for fibroids and additional information about the Sonata treatment. Today we are joined by Dr. Julie Vu, who is from Advanced Gynecology of West Houston. She is a minimally invasive surgeon practicing out of Memorial Hermann in Memorial City. Dr. Vu, thank you so much for joining us, and I will go ahead and turn it over to you.
Hi, thank you so much, and thanks for inviting me to talk about options for treatment of fibroids. We'll just briefly go over fibroids and then concentrate a little bit more on the treatments. Next slide. And next slide. So what are fibroids? They are basically benign tumors of the muscle of the uterus. Benign meaning not cancer. And the fibroids can be located in different places in the uterus. Based on their location, they can give you different symptoms. Next slide. So the interesting thing about this is that if the fibroids can be very, very large and not cause symptoms, or very small and still cause symptoms depending on their locations. So a submucous fibroid is one that is near the lining of the uterus, and this often causes heavy periods and bleeding and spotting between periods. It can also cause infertility. Intramural fibroids are in the muscle of the uterus, and they may, when they're large enough, affect your bleeding as well. Subserous fibroids, on the other hand, those fibroids are usually further away from the lining, so they can cause symptoms of pressure, bloating, running to the restroom a lot, without necessarily affecting the bleeding pattern in all cases. Next slide. So just some facts about fibroids. In the United States, 70% of white women and 80% of Black women by the age of 50 will have uterine fibroids, but not everybody has symptoms from these fibroids. For the 20 to 50% of people with symptoms, though, these are the ones that will need treatments. And about 2 million women undergo treatments each year in the United States. Next slide. So how do you know that you're having symptoms of fibroids? If you have very heavy periods, if you have prolonged or painful periods, sometimes bleeding in between periods, and if these things are causing you to miss out on your normal life, then you should definitely talk to your doctor about these symptoms. One of the first things we'll do is order an ultrasound of the uterus to see if there are fibroids, and sometimes we'll order MRIs if we need more specific testing, the location and sizes of the fibroids to see if you're candidate for minimally invasive options. Next slide. So interestingly, women may not seek treatments early on because they may think it's normal. Their mom had heavy periods. And so sometimes women go 5 years or more before they get treatments. Unfortunately, getting treatments later can sometimes mean that there may be larger fibroids or too many fibroids, and some of the options that are great for medium size or smaller fibroids may not be an option any longer. Also, depending on what a woman, what her goals are, some women may want to preserve their uterus to have children, or just in order to keep their uterus because they're attached to it as part of their femininity. Next slide. So now we'll go over some of the fibroid treatment options. Next slide. So if you have heavy periods, you should know what your choices are. Next slide. And most people will start off with some medical management. And that includes things like birth control pills, as well as options that can decrease your hormones. Nowadays, there's a lot of other options rather than just birth control to help with the management of the bleeding from fibroids. Next slide. It is important to point out, though, that although medical management can help with the symptoms like heavy bleeding, that it does not cause the fibroids to shrink or to be gone. So in some cases, with hormonal treatments, it may even cause the growth of fibroids. And also, when you stop using the medications, your symptoms will return. Next slide. For minimally invasive options, there are hysteroscopic myomectomies, which are a great option because there's no incisions from this surgery. Generally, we put a camera through the cervix into the uterus and then remove fibroids that are impinging on the lining of the uterus. The only problem with this surgery is that not every fibroid is a candidate for this surgery. So location-wise, it has to be one that is in the lining of the uterus, with most of it coming into the endometrial cavity. And only about 20% of fibroids fit into this category and are of the size where they can be removed this way. Next slide. Uterine artery embolization is an option where you have a radiologist access the blood vessels that go to the uterus, and they can embolize the blood supply to the fibroid or the uterus in order to decrease the size of the fibroid. Although this is very minimally invasive, it does not mean that there is not a recovery period from it. So there's generally an overnight stay for pain control. You can have a post-embolization syndrome where shortly after the surgery and in the first week or two, you can have pain and fevers, elevated white blood cell count, and rarely, especially in women in their 40s, the embolization can cause some women to go into menopause. Next slide. Another minimally invasive option would be a laparoscopic myomectomy. There are also open myomectomies where we remove fibroids through a larger incision. So this is a surgery. There are incisions on the abdomen, either small ones or a large incision. The surgery does require anesthesia. A laparoscopic myomectomy could possibly end up with the patient going home that day or an overnight stay, whereas an open myomectomy generally requires a 1 or 2 day stay in the hospital. Now, this is a good surgery for women who are trying to conceive, to have a pregnancy, because when you fully remove the fibroid, it does improve your chances of being able to achieve a pregnancy. But because the uterus, this is also the surgery that has the most bleeding. Because it could possibly end up in some women needing a blood transfusion. Removing the fibroids does not remove the uterus, and so you can have fibroids grow back in the future. And next slide. And then you have a hysterectomy. And actually, for most people who choose a hysterectomy, those are going to be your patients who are completely done with childbearing. This actually removes the entire uterus, and so you will not have periods any longer. You won't have heavy bleeding. Sometimes the surgeries can be done laparoscopically or in a minimally invasive way, and some of them require a larger incision and a stay in the hospital. The rates of people who are happy with their hysterectomy are pretty high. However, it has to be a patient who is done with childbearing and one who has the time to take off for a longer recovery. For open myomectomies, a lot of patients will stay home for 6 weeks. For laparoscopic myomectomies, at least 2 weeks. Next slide. So what is the Sonata treatment? So we're here today to talk about the Sonata, which is a great new procedure in that it is incisionless, so no incisions on the abdomen. It does preserve the uterus for women who are trying to preserve the uterus, and it does not require an overnight stay in the hospital. Next slide. So this is a video demonstrating the Sonata procedure. And the Sonata is a radio frequency ablation of the fibroids done under ultrasound guidance. So you can see the Sonata handpiece here. It has an ultrasound on it, and so it's placed through the cervix into the uterus to identify where the fibroids are. And the image you're seeing on the bottom left there is what we would see the ultrasound image of where the fibroid is. And then using that ultrasound image, we are able to place a needle into the fibroid. And what you're seeing with the red line and the green line there, the red line is your ablation zone, the part that you're treating. And the green line shows how heat dissipates as it is the further away from the area of treatment. So it's safe because you can see that you've placed the line fully within the uterus and not outside the serosa of the uterus, so that you're not burning any other organs unintentionally. Now, the radiofrequency ablation will occur after some safety checks to make sure that you're in the correct place. This normally takes 2 to 7 minutes. And then when the instrument has completed applying the heat, you can retract the electrodes and the needle, and then withdraw the Sonata from the uterus. The great thing about this procedure is that your recovery from it is very, very fast. 50% of women will go back to work within a day. Go ahead and next slide. The Sonata treatment, is it safe and is it effective? So now there are more than 8,000 women worldwide who have been treated by the Sonata. So although it's rather new in the United States, it's been here a few years. It's actually been used in Europe for quite a few years. And there are over 50 articles published in medical journals showing the safety and efficacy of these treatments. Next slide. So here are some of the results of those studies. So they looked at 147 women over the course of 3 years in the Sonata trial. 50% returned to work the next day. This is so important to my working women and moms who don't really have the downtime. They're able to return to their lives very quickly. 95% had a reduction in menstrual bleeding at 12 months. So the treatment ablates the fibroid, but it shrinks over time. And so after 2 or 3 months, you'll be able to see the reduction in bleeding. And at 3 years' time, 94% were satisfied with their treatment. And 88% had improved symptoms, which means that this is a very, very well-tolerated procedure, as well as one that is pretty successful. There are women, there are 12% of women who, after a certain amount of time, 3 years or 5 years, may need another treatment because the uterus still remains. But the majority of women are successfully treated by this. Next slide. And next slide. So if this is a treatment that you are interested in, then a few ways to learn more about this procedure or just options in general for fibroid treatment is to scan the QR code that is provided on the website, or go to, I believe, is it sonatatreatment.com?
Yes. Yes, that is correct.
Wonderful.
Yep,
Great.
so if you have any questions as you're watching this webinar, you can go to sonatatreatment.com to connect with our nurse advocate, who will be able to connect you to Dr. Vu's office directly to schedule that consultation.
Very much.
All right, thank you so much, Dr. Vu. We appreciate your time.